Chronic spine and disc pain can make daily living unbearable for some long-term sufferers, although there are treatments options available, such as surgery, that may not always provide lasting relief. Dr. Don Palmer is a chiropractor and international herniated disc specialist. He's treated over 660 severe chronic disc sufferers from all over the United States and from other countries. He's got the experience to end your severe back or neck pain. He joins me now to share more about some of the treatment methods he uses in his practice. We want to welcome you back to the show.
All right, thank you.
So you can relieve pain, right?
More than relieve. We can actually help to heal the disc condition that's going on with patients.
That's really exciting because a lot of people are suffering out there and they go through all these things and then it just comes back.
You don't even realize we have so many patients coming in, like literally by the hundreds, that are suffering, and it continues to progressively get worse and they can't find help anywhere.
Now, Dr. Palmer, you have something really special. It's the Palmer Proprietary Protocol.
Yes.
I got it right because you said it was a tongue twister.
Yes.
And patients that benefit from that protocol is just amazing. Can you tell us about that?
Well, what I've done is I basically gone out and scoured the world literally to find the best breakthrough technologies available to help treat these kind of severe degenerative disc conditions. And basically the manufacturers have treatment protocols that I literally threw out within a week. What they're showing here is non-surgical spinal decompression, which is FDA cleared for treating herniated and degenerative and bulging discs. We also utilize Spine Force technology, which is FDA approved as the only technology that can actually help to treat the intrinsic muscles of the spine. And then we use the best that research has to offer in regard to protocols of rehab, as well as Class 4 laser technology to decrease pain, increase healing of the tissues, and we can penetrate that 9 inches deep into the body to help healing rapidly increase.
Has technology really come that far that we can do these for patients now?
Absolutely. Prior to this technology, if a person had a herniated disc, it was pretty much considered permanent damage. And now we can take a disc and we actually start to heal it, as we're going to show on this show today.
Wow. And so since the Palmer Protocol is unique and only found in your office, you've been treating people from all over the U.S. and other countries.
Yes, I'm not restricted just to Folsom where my practice is. We treat patients from all over the greater Sacramento areas, as far as Grass Valley, Modesto, Vacaville, Reno, and Tahoe. Patients travel 3-4 hours sometimes to come to our office. But I've also treated as far as San Diego, Texas, Arizona, Nevada, even other countries. I just consulted with a patient from Croatia.
Wow.
Who doctors in her country as well as in Germany told her basically there's nothing that we can do to help you. In fact, they said go home and die in pain.
Gosh.
It was horrible, yeah. So, and I also treated a patient from Canada.
Because they can't get the same treatment there.
Correct.
They need to come to you. They need the proprietary one there.
That's right.
And she was told that she needed emergency surgery, right? But you were able to help her?
Yeah, we're going to talk about Rebecca Turner. She was a patient from Canada, and she was told she needed emergency surgery, and she had a very severe condition. She had 7 years of constant degenerative, progressive pain. You can see here on her MRI on the left side, I know you're not a radiologist, but on the left side you can see the lower disc there. It looks like a tongue sticking into that white area.
Yeah.
That's a 13 millimeter disc herniation going into her nerves and crushing them. And then you can see on the right, we treated her for only 5 weeks, less than the time that it takes to recover from surgery. And we've reduced that disc bulge considerably, where her nerves have tremendous amount of room now. We're going to show another view of this, which is an axial view on MRI, or at least I thought we were. There we are. And you can see on the left side, the disc is extruding out about 13 millimeters. It looks, again, like a tongue going into the nerves. And then 5 weeks later, we've reduced it down to almost about the size of a BB. That's it. And we ended 7 years of constant progressive pain. And she was able to not only avoid surgery, but that was almost 4 years ago. And she's still doing great. She lost 35 pounds. She's able to have a second child, take care of that child. Her husband was Mr. Mom, basically, because she was in so much pain all the time. And she hasn't done one single treatment with me again, and yet she's had these results long term.
And I bet that patients really appreciate that too, because I would imagine that the recovery from surgery would be painful and it would be hard and it would take a long time. And in 5 weeks you're able to do that?
Yeah, not only that, but it's not very effective. I mean, it's been reported multiple times based on the research to be not only very expensive, but very risky and also not very good outcome. Plus, surgery of the spine really only addresses the symptoms of the problem, or attempts to, doesn't really address the disc problem. that's what we were able to do there, is actually treat the cause of the problem, which is the disc, and that's why we get long-term success.
That's excellent, because I think some people might be skeptical and think, oh, it's just going to prolong the inevitable, but it's not. It's actually, you can prevent surgery with this.
Well, our statistics clinically are that we have a 92 to 93% patient satisfaction rate treating the worst of the worst disc patients. We don't treat the easy cases, we treat the worst ones. I've treated over 660 patients with this new technology, which, as far as I know, is the most out of any doctor anywhere. And I only have a 2% reoccurrence rate, which means that once we treat a patient and get good results, it's very seldom that the problem comes back again.
Well, I think that's really exciting. If there are people out there that are suffering and have disc pain or things like that, and how do they know if they can come to you and if the Palmer proprietary protocol will work for them? How do they find that out?
Yeah, for one thing, they have to have a severe degenerative condition that's really unresponsive to other types of therapy, unless they have an MRI that shows a severe compression. But to help patients, we have them call our office, and they basically go through a protocol of questions that are asked to see if they are a candidate, and then I interview them to make sure and do some examination processes to make sure that they're actually an ideal candidate. And if they are, then we absolutely can help them.
I think it's exciting that all the technology and how far the whole world has come, and the way that people can help themselves and live longer and be pain-free is a really neat thing. And you have a special offer.
Yes, if somebody viewing this is really struggling with progressive pain and they're really not getting any help, then we've created a situation for them where they can call within the next 5 days, and we have to do a lot of evaluation. So I do a 19-point physical evaluation on a patient to determine their eligibility for this procedure.
Excellent, and that's free for the next 5 days. There's the number on your screen, 800-871-2157. Dr. Don Palmer with the California Spine Pain and Weight Loss Center. Exciting things going on in your field.
It's very exciting.
That's really, congratulations too. It's nice that you're helping people.
Thank
All
you.
right, call for your free one today.
You're having a lot of pain, right?
A lot of pain.
Yeah, and where do you feel the pain?
And all my back and into my both legs and both sides of my back.
So when you were sitting, it was just intolerable?
Intolerable, yes.
Okay.
I'm a sitting pain, even laying down I'm in pain.
Okay. All right, so you're excited about getting treated?
Very much so.
All right. Well,
Very excited.
Well, we
I'm
can't
very
wait
motivated.
to film you after you're perfectly fine. That'll
I
be
hope
good.
so.
Yeah. What improvements have you noticed since the last exam?
I'm standing up.
Yeah, you're standing for one, right?
Standing up, I can walk, I can sit, I can sleep better, so a lot of improvement.
That's fantastic.
Yes.
Well, I'm glad. We're only halfway through, so we've got some more to do.
I look forward to it.
My name is Walter Penrod. 6 weeks ago, no sleep, terrible pain in my neck. Saw Dr. Palmer's ad in the paper and decided to try it out because my back's very important to me. Came to Dr. Palmer, went through some of their treatments with their machinery that I was a little skeptical about at first. Started out, first week or so I was a little sore, but it was like overnight, and my back feels so much better now. My range of motion is fantastic compared to what it was. My pain is gone. My pain level is 0. Every once in a while I get a little twinge in my neck, but that's going to be understandable. My pain level's gone. I can do everything I want to do. I'm very pleased with this, and I'm going to check into their maintenance program because I want to take care of my back. And their staff is very professional. Dr. Palmer does a good job, and I'm very pleased with my outcome.
Well, when I got here, it was like standing for any length of time at all was very difficult. Walking short distances was really tough, and now it's like I take the dogs out. We walk probably a mile each morning. I'm able to do yard work around the yard, and I'm not that tingling and numbness and stuff that I was experiencing in my legs and back and stuff is gone now. I started getting results. It felt like the tingling and the numbness started to move out pretty fast.
Okay, and is this a program that you would recommend to other people?
I already have.
Yeah, well, 5 years ago, I was moving my office carrying a box of books, and I herniated my discs, my L542, S1 and 2, to the point where I couldn't walk. I was dragging my left foot. I had tremendous pain down my left thigh. It stopped at my knee, I even had a great deal of pain that went down into my groin. I literally could not walk. I was in an awful lot of pain. I went to the doctor, and naturally, my primary care physician, they loaded me up on drugs, so loaded to take care of the pain that I didn't know who I was. I was talking to people and didn't know who they were, people I'd known all my life. I was just talking crazy, loaded with pain. I got to the point where I realized I didn't want to live that way any longer. I was, 5 years ago, I was about 68 years old at the time, and so I took myself off the drugs, and I had to deal with a tremendous amount of pain at that time. So I heard about Dr. Palmer, and I came to see him, and then found out about the DRX9000 machine. I watched the videotape, I was very impressed, and I had nothing to lose and everything to gain. So I took the treatments at that time. That was 5 years ago. I took 20 treatments on my third. It was either my second or my third treatment. I had no pain. I walked out of the office pain-free, had full range of motion. I completed the 20 treatments, and I was great. And I'm walking, and I feel great. I have full range of motion. I have back, my quality of life is back. I've recommended this to many, many people. I'd recommend it to anyone. You have nothing to lose, but you have a life, get quality back of life.
My name is Tony Stalter, and I came to see Dr. Palmer because I couldn't take the pain anymore. I was, I guess, pain level of 8 to 10, and I couldn't even work. My business was losing money. I was losing money. I mean, it just wasn't even conceivable to continue working because I was in so much pain. So I came to Dr. Palmer. My mother saw an ad, big spread page ad in the newspaper, and she gave it to me, and she says, call these guys, see what they can do for you. So I came in and I qualified and began the treatments. Probably within the first couple of weeks, I started noticing a difference in the pain level, and that was a tremendous relief. I stopped wearing pain patches. I stopped taking Vicodin, which before I was coming in, I was taking Vicodin. I stopped, I quit smoking because they told me I had to, but it made a huge difference in my recovery, is quitting smoking. Within the 6th week of my treatment, I was almost, I'd say my pain level went from the 810 to a 2.3. And now I'm probably at a 1.2. I'm very happy with my treatment. I'm very happy with everything. I can do so much more. I can actually now play with my grandchildren a little bit longer. I can work with, and a perfect example, the other day I had somebody working with me, and they said to me, Tony, slow down. Didn't realize I was walking fast, which I haven't walked fast in over a year and a half. I took baby steps to the stores, and it took me hours and hours just to get through a couple stores, and now I'm doing 10 stores a day. And I did go to church yesterday. My niece was singing in the choir, so she asked me to come. Well, Catholic churches, they make you stand for long periods of time. Well, I stood there the whole time, and normally I would have had to sit down, and it was really surprising at the end of the service that I was able to keep standing. No worries, no pain, no nothing, and just had a wonderful time this year.
Hi, my name is Mike. Approximately 3 years ago, I had a treatment here on the 9000C and for neck decompression, and I walked out of here feeling great on my last treatment, and have remained so. There were times prior to coming here I couldn't even bend over and tie my own shoes for fear of falling over. I couldn't raise my left arm up above over my shoulder. This treatment was a lifesaver for me. And as I said before, as treatment progressed, it continually got better and better, and has remained that way since then. I think the major part of it was getting a good night's sleep, not rolling from one side to the other trying to find a comfortable spot. I'd say maybe in an 8-hour night of sleep, I may have gotten 3 hours of broken sleep. Energy during the day to do things, lifting small items got a lot easier. I was able to tie my shoes at the end of the session. I was able to tie my own shoes without fear of falling over. Excellent. I feel great. I've told anybody and everybody I've met who's had a problem in this area, come on out here.
When I came to this office, my back was in terrible shape and I thought I was going to have to go into a wheelchair. And I have had back problems since I was 37 years old, and I am now 76 years old, and I feel so much better, and I have hope that I'm going to get totally well from my treatments that I've had here so far. I found the ad in the newspaper and found out that I could do something for my back without having surgery, and I am so pleased that I did find this place so I could get help with my back, and I have hope that I'm going to totally get well, and I am so much better, and I don't have to fear going into a wheelchair now, which is the greatest thing that I can imagine to think about. And if you're having back trouble, I would certainly recommend you coming and giving it a try.
Chronic spine and disc pain can make daily living unbearable for some long-term sufferers, although there are treatment options available such as surgery that might not always provide lasting relief. However, there is a new treatment available that may be able to take the pain away. Dr. Don Palmer is a doctor of chiropractic specializing in severe degenerative disc conditions. He joins me now to share more about some of his methods he uses in his practice that have helped those dealing with chronic spine and disc pain. Welcome back to the show, sir. Good to see you.
Thank you, guys. Nice to be here.
Thanks for coming in. Okay, I got to ask you, explain to me what the Palmer proprietary protocol is.
Well, we utilize a lot of the best technology that we can utilize to help patients with severe back and neck pain, specifically related to discs. So we use things like the most state-of-the-art non-surgical spinal decompression that's non-invasive. We utilize different FDA-approved technologies in muscle rehabilitation. You're seeing the decompression there on the screen, class 4 laser technology, and the best that research has to offer in regard to progressive rehabilitation.
Now, this protocol, this was developed by?
I utilize technologies that have been invented, and then I put them all together, and that's my protocol.
Oh, very nice. Okay, and patients are benefiting from this?
Yeah, the patients who benefit the most are patients who have severe chronic degenerative disc conditions that have been unsuccessful with any kind of conservative treatment and may even been told they need spine surgery. We're able to help those patients with disc conditions like herniated discs, disc bulging, protruding discs, disc herniations of that sort. Anybody who has MRIs with stenosis and they have the type of symptoms that result in them having searing pain going down their back, down their legs, down their arms, particular numbness in certain parts of their feet and their hands.
Now, I hear the Palmer protocol is unique to your office here, and that you've helped people all over the United States and internationally too.
Yes, we've had patients from all over Sacramento, even as far as Stockton and Bakersfield and all kinds of different places. San Diego, I've treated patients from Texas, Arizona, Nevada, even other countries. I just consulted with a patient from the Eastern Bloc in Europe, and I'm going to be treating her, and we treated a patient from Canada as well.
Oh, okay. Oh my gosh. So is that because they can't get the treatment that they need in their country?
No, they actually have non-surgical spinal decompression in some of these areas, but they're coming to me because I have a tremendous amount of experience. I treated over 660 patients with this technology, which is very new technology, and that's a lot. I have a lot of experience, and these patients tell me they want to do it right the first time.
Right. Okay, but in this patient that you're talking about, in her country, wasn't it suggested that she have surgery?
Yes, in fact, we're going to talk about the Canadian patient in particular because she's very unique in that she did a pre-post MRI study as well as she was scheduled for emergency surgery within 2 weeks by the time she came and consulted with me. This is a patient who had chronic 7-year battle with back pain that progressively worsened to the point where she had sciatica going down her leg. And you can see here on the screen the pre-post MRIs. She couldn't even walk, and that was because on the left of your screen you can see, I know you are not a radiologist, but you can see that lower black line. There's a disc, it looks like a tongue sticking out into that white space.
Oh, yeah.
That's a 13 to 14 millimeter disc herniation that was basically crushing down on her nerves. And then you can see on the right of the screen, after 5 weeks we did a post MRI and we've reduced it down to about a 1 to 2 millimeter disc abnormality, but she's got tons of room. Here's another view of that same disc looking right through the disc.
Out, yeah.
See that sticking out right into that center area, and then on the right you can see it's barely even visible. It's about the size of a ball bearing. We ended 7 years of constant pain for her. She avoided surgery, and basically after that, it's been almost 4 years now, and she's doing great, and she hasn't done any treatment since.
So your protocol allowed her to avoid having surgery.
Yes.
Do you find this to be common with a lot of back and disc pain sufferers?
We've helped about 92 to 93 of the 660 patients avoid surgery. And the interesting thing here is that there was a confusion amongst her doctors, her GP, her neurologist, and her spine surgeon. They thought that what we were doing was traction, and when we showed them the pre-post MRIs, they were astonished. They'd never seen anything like that, didn't even know it could be done. It's not traction, it's the protocol that we've utilized to treat these conditions.
That's interesting. Now, does it depend on the severity of each case, how long the procedure?
How long it lasts?
Yeah, how long, or how long, how many times you have to visit,
yes.
And how long does it last?
Yeah, that's a great question, Guy. The amount of time that a person is going to need to be treated will vary depending on the severity of the condition, but on average, somewhere between 5 and 7 weeks. It's a very short period of time to utilize the treatment. As far as long-term results, like this patient from Canada who got these results, it usually lasts a long time because we're actually treating the disc condition itself, not just patching a symptom.
Exactly. Well, I'm sure that's encouraging to a lot of people out there. What can severe back and neck pain sufferers do to find out more?
Well, you're going to show on the screen here basically our offer. We have, part of my protocol is a very extensive 19-point examination where we help determine whether a person's an ideal candidate and to diagnose their condition, and we're offering that free of charge to your viewers as long as they call by October 13th.
Okay, and there's all the information right there on your screen. You can also get it at our website at sackandco.net. Dr. Don Palmer with the California Spine Pain and Weight Loss Center. Again, it's a pleasure having you on our show, sir.
I appreciate it, Guy. Thanks
for
so
helping
much.
people feel better.
You
We
bet.
like that.
It's my pleasure.